Okay, so to start the last session of our annual convention before the business meeting, uh, we are the Philippine Board of Orthopaedics, and there will be 4 lectures for today. I will be introducing all the speakers, and then we will listen to all their talks. First speaker had his medical training at the University of the East, Ramon Magsaysay Memorial Medical Center, his orthopedic training at the Philippine General Hospital. His greatest achievements are being a husband, father, grandfather, teacher, and surgeon, not necessarily in that order. To talk about what worked, the adaptive changes in accreditation and examination during the pandemic, we have Dr. Jose Maria Coruña. Next up will be uh, a doctor who had his medical training from St. Louis University, orthopedic training at Baguio General Hospital, and subspecialty training at Philippine General Hospital and Royal Adelaide Hospital in Australia. He is presently our Vice Chair of the Philippine Board of Orthopaedics and Exam Committee Head. It's none other than Dr. Isagani Garin to talk about the test construction workshop. To follow him will be uh, a former dean of the College of Medicine of the Angeles University Foundation. He had his medical education at the University of the East, Ramon Magsaysay Memorial Medical Center, orthopedic training at the Philippine General Hospital, and subspecialty training at Singapore General Hospital. He is the present chair of the board, and he will present the guidelines on examination and accreditation. And last but not the least, this man needs no further introduction, so this will be very brief. He is past chair of the Philippine Board of Orthopaedics, and everyone knows him. To give a talk on the board's golden anniversary celebrations will be Dr. James Pagaw. Okay, so let's listen to their talks.
Mabuhay. Ako po si Boy Coruña, kasalukuyang ex-officio ng PBO. Naatasan ako mag-ulat sa mga tugon ng PBO ukol sa pagsaliksik ng mga training programs at pagbigay ng eksaminasyon sa mga trainees noong panahon ng pandemya. Stories of Wuhan floated during the 2019 holiday season. 2020 started with a bang, Taal volcano acted up. By end of January, the first case of COVID-19 was reported in the country. By then, several programs had already been listed face-to-face, and practical examinations were conducted and concluded in these institutions. March 15, the country went on lockdown. The PDO is mandated to accredit all training programs. We started using the Zoom platform for virtual visits. Board meetings were all virtual. Increased use of social media was both bane and boon. There was no way to conduct the examinations we are all used to. The written part at UST, the oral exams at our usual venue, the practical exams in the training institutions. Early in 2020, the board created several resolutions. One was to extend the validity of the practical exams for those who have passed, and another to remove Part 3 of the diplomate examinations for various reasons. No examinations were conducted in 2020. Preparations, however, continued for future exams. The PDO designed an online, center-based examination, but the PMA IATF still deemed this face-to-face, and we scrapped that. In November, we undertook a trial diplomate examination, written and orals, online and home-based. Difficulties were encountered, these were analyzed, corrective measures adopted. We never expected the examinations to be perfect. By March 6, the qualifying examinations for senior residents for 2020 went online. Our March experience became the basis for the April diplomate examinations, both written and orals, for those who should have taken their diplomates in 2020. The apparent success boosted our confidence level so that levels 1, 2, and 3 in-training examinations were finally held in September together with the qualifying examination for senior residents of 2021. An October 2021 diplomate exam for 2021 graduates was also conducted. The 2020 examinations were considered a lost cause and would not be used as requirements for the residents. Home-based, online examinations did work for our purposes. As mentioned, 5 visits were already completed. After lockdown, all accreditations were shifted using the Zoom platform. The virtual platform still allowed a semblance of interactivity, and the engagement seemed as if we were there. For calendar year 2019 or for visits in 2020, summative assessments were meted out as usual. For calendar year 2020 or for visits in 2021, the board decided all assessments would only be formative because there were missing parameters for that calendar year. Suggestions from the board through the programs were passed on, but more importantly, the trustees learned how the 23 programs all over the country were trying to cope with the problems brought about by the pandemic. The virtual platform offered the programs a forum to showcase their adaptive changes. Observations during the lockdown. Public transport came to a near standstill. Patients found it difficult to access the hospitals. Mobility of doctors was affected. Some of us even got sick. Outpatients were closed. Follow-ups were via Facebook, Messenger, or whatever app. Follow-up imaging was possible but still problematic. Government and private facilities were similarly affected, bringing census down. On their own, programs adopted virtual teaching modalities, which simulated but never came close to actual patient contact. Minimum case requirements were difficult to fulfill, possibly delaying some residents. Because of the loss of the practical exam, the board suggested its replacement with a series of observational assessments done by program directors themselves. This takes away the one-time, big-time pass or fail practical examination. In October 2020, an online pedagogy skills training, both synchronous and asynchronous, was conducted with the help of the Philippine Orthopaedic Association and the Council for Orthopedic Residency Training. Some assessment tools were suggested but not limited to the following: direct or video observation of a procedural skill, mini clinical evaluation exercise, case-based discussions, OSCE, OSATs. The board was fortunate to have observed best practices nationwide, but due to time constraints, let me showcase a few, but certainly not limited to such institution-driven innovations for training. In Baguio, video live feeds of simulated tenorophyes or suturing were possible through a rickety but effective tripod. In Bacolod, an app-based templating system comparable with the usual pen and paper was used, and pre-op and post-op results could be layered for comparison. In UPPGH, they dragged an iPad on wheels to simulate the feeling of face-to-face rounds. They also took advantage of well-preserved cadavers for dissection, observable in remote sites. In short, training programs need not stop during a pandemic. Numbers and variety of cases may be limited, which is why there is a need to review the possibility of extending the current 4-year to a 5-year curriculum. but this is left to the discretion of the training directors and hospital administrators. Accreditation visits did go on virtually. Online, home-based certification examinations with precautions were safely conducted. Countless assessment tools and learning modules were optimized because of the internet. Innovative teaching modules were welcomed. Many of the adaptive changes we have undertaken did work. Maraming salamat po. Magandang umaga.
Good day to everyone. This is the Re-Echo our test construction workshop during the first quarter of 2022. Our objectives for the workshop are as follows. Determine the outcomes of significance for the residency training program. Understand a test blueprint based on a given set of outcomes. Formulate valid and reliable multiple choice questions. Set the minimum passing level for a given examination and interpret test item analysis results. Our workshop output are as follows. To understand test blueprint, we have multiple choice questions, MPL setting method, and self-assessment and client satisfaction survey. Every year, the Philippine Board of Orthopaedics, in cooperation with the Philippine Orthopaedic Association, Council for Orthopedic Education, conducts test question workshop for all the training programs. This year, 2022, we tapped the services of the National Teacher Training Center for the Health Professions, spearheaded by Dr. Melchor Atienza, the Dean of NTT CHP UP Manila. The workshop was a two-week lecture series held by a Zoom platform with approximately 158 participants from different institutions. The first week was lecture sessions about overview of outcome-based assessment and formulating multiple choice questions. Participants were grouped under the supervision of two faculties, one each from the POA core and the PBO. 12 groups were tasked to formulate their test questions according to a category and subcategory topics randomly assigned to them based on the PBO's test blueprint. A week later, these formulated questions were evaluated, held by Zoom's breakout rooms. The second week was lecture sessions on setting the minimum passing level, the item analysis, and how to conduct online written examination. This was followed by consultation and awarding of certificates.
It was a fruitful learning experience with all the different participants from different training programs indeed.
And the PBO would like to thank the following POA core faculty: Dr. Leong, Dr. Kat Pagan, Dr. Pua, Dr. Caro, Dr. Javier, Dr. Aureliaza, Dr. De La Paz, Dr. Flores, Dr. Dunca, Dr. Roxon, and Dr. Estrella. Thank you.
Good morning to all. I will be presenting this morning the present guidelines on accreditations and examinations for 2022. Because of the coronavirus Omicron variant surge in the beginning of 2022, the board has to decide early on the type of accreditation visit we will have to do in 2022. The decision of the board was to do face-to-face visits for 5 new applying institutions and continue on with the virtual visits for the remaining 23 institutions. So the revised A2O form have now new grade allocations for what you have implemented in your programs last year as follows. There is a gradual increase for workplace and performance-based assessments, resolution number 5, series of 2021. Then gradual decrease in written assessments. And the third is the phase out of Diplomate Part 3 practical examinations covered by Board Resolution number 3, series of 2021. These are the revised forms that were implemented last year and to be addressed this year. First is the ACO2 program evaluation, then the surgical caseload and variety, the ACO6 annual report for training programs, ACO6A annual report on external rotations, ATO5 surgical skills assessments, ATO6 exit practical examination, and 3 rubrics, ATO6, ATO7, and ATO8. The rubric for workplace assessment tools and rubric for performance-based assessment. Early on this year, we pass a board resolution number 4 on the non-inclusion of 2021 in training examinations in the assessment for accreditation. So the 2021 ITE level 1 to 3 will be considered as a formative evaluation to help the training programs know the level of knowledge that their residents have acquired across the different year levels in comparison to the other residents in other training programs. The qualifying and diplomate exams, however, will remain as summative evaluations. What is the more important provision of this resolution is that the results of the ITEs for levels 1 to 3 will not be included in the computation of the theoretical knowledge as one of the must-pass criteria in the assessment for accreditation, the ACO. So as of June 15, 2022, the board finished virtual visits to 17 out of 23 institutions and finished face-to-face visits to 4 out of 5 new applying institutions. By July 30, 2022, we'll be finished with all the visits to all institutions. So after a hiatus of 2 years, these are some of the pictures taken during our face-to-face visit in the Department of Orthopaedics, Region 1 Medical Center in Dagupan, in Pangasinan, last April 9, 2022. Inside their big conference room is the picture on the left, and then on the right is the inspection of the required textbooks. We made rounds also in their emergency room and wards where we asked the residents of their cases. The next visit was in the Department of Orthopaedics of the Eastern Visayas Medical Center in Tacloban, Leyte, last April 23, 2022. Shown here is the Chief of Hospital, Dr. Salvador Ibardone, delivering his welcome remarks, and the resident staff of the department on the left side of our table. These are the consultant staff on the right side, and a picture of the San Juanico Bridge at night taken after the conclusion of our visit around 7:30 p.m. So the latest visits was held in Batangas Medical Center Department of Orthopaedics last May 28, 2022, and the University of Cebu Medical Center last June 15, 2022. So that concludes the accreditations. We now go to examinations. 2 plans were drafted as Plan A when there is no COVID surge and Plan B when there is COVID surge. So examination types will still be both written and oral examination for diplomates, and ITE for first to third year levels, and QE for graduating residents. The schedule and venue of the examination is as follows. For 2022 written and oral exam for diplomates, as Plan A with no COVID surge, it will be a face-to-face written exam at UST on July 9, 2022. Then a face-to-face oral exam at the RCDC building, sponsored by High SI Pharma, on July 10, 2022. If there is a COVID surge, then we will have to fall back on the Plan B, where we have designated regional sites on July 23, 2022 for the written exam, and July 24, 2022 for the oral exam. The sites will be at UST for North, South Luzon, and NCR examinees, and UCMC for Visayas and Mindanao. For the 2022 in-training exam and qualifying exam, if there is no COVID surge, it will be a face-to-face examination at UST. In the morning, it will be the first and second year examinees, and in the afternoon, it will be the third year and fourth year examinees. If there is a COVID surge, three sites were designated UST for North South Luzon and NCR examinees, UCMC for Visayas and Iloilo tripartite, and Xavier CDO for Mindanao. So I think that concludes the examination updates. So thank you and a pleasant good morning to all.
A pleasant morning, my dear colleagues. It is with great pleasure that the Philippine Board of Orthopaedics Incorporated announces the celebration of its 50th founding anniversary this year, 2022. Having been formally established and duly registered its articles of incorporation with the Securities and Exchange Commission on the 29th of February in the year of our Lord 1972. Just for added information, perhaps a lot of us are not aware of, more so for our younger colleagues. The PBO then was composed of 5 trustees only, and the first chairman of the board was the late Dr. Rodolfo C. Di Mayuga. The other 4 trustees that constituted the board were Doctors Manuel T. Rivera, Benjamin V. Tamesis, Antonio C. Acosta, and Dr. Jose M. Pujalte. All of these honorable gentlemen subsequently faithfully served as chairman of the board in the years that followed. May their soul rest in peace eternal. To commemorate this historic event, the Golden Anniversary Committee is currently working feverishly on a 50th anniversary commemorative book, compiling its humble beginnings to what it is today, from 1972 to 2022. It would be an interesting read, replete with documentation of historic events caught on camera, excerpts from the men and women who have unselfishly served and steered the PBO throughout the years. There will be articles and anecdotes gathered from all PBO accredited training programs, together with a brief history of their department, with a collection of photographs. These and your stories, among others, will grace the ornate pages of this golden anniversary memorabilia. Indeed, a worthy addition to your collection, as we reminisce the past and look forward to the future. That said, may I remind all PBO accredited training programs to please submit their articles and write-up on their history on or before the end of this month. This is to give us ample time to include it in the final layout of the commemorative book. To raise much-needed funds for the activities mapped out for the 50th anniversary celebration, the last section of the book has been appropriated for advertisements. This will be open not only to our stakeholders and industry partners, but also to other business establishments not related to healthcare, like diners, restaurants, retail stores, telecommunications and media companies, food and beverage, individual or group donors, and other friends of the PBO. Funds derived from our sponsors and advertisers will immensely help defray the expenses involved in the creation of the commemorative book and for the series of activities laid out to commemorate this momentous event. To add color to this milestone, the board is happy to announce the resumption of the much-awaited search for the outstanding orthopedic residents for the year 2022, which has been conspicuously absent for the past 2 years, 2020 and 2021, due to the pandemic. The rules and requirements will remain the same, except perhaps in the last stage of the evaluation, the personal interview, looking at it with cautious optimism. Please take note, There will be a culminating program for the Golden Anniversary celebration. Please save the date. This will be on November 12, 2022. All proceedings of the program will be fully virtual using the Zoom platform. For our keynote speaker, we have invited the renowned educator, Professor Lee Eng Hin of Singapore, to give an inspirational talk. We have invited other distinguished speakers to grace the occasion. Dr. Ian Inkle of the Australian Orthopaedic Association, who will speak on the topic Contemporary Best Practices in Orthopedic Training, and Dr. Jenny Green of the International Orthopedic Diversity Alliance, who will speak on the topic Gender Issues in Orthopedic Training. Other highlights of the program are recognition of the successful candidates for the Search for Outstanding Orthopedic Residence Awards for the year 2022, recognition and induction of the new diplomates for the year 2022, the Golden Anniversary book launch, ceremonial turnover of the PBO chairmanship for 2023, and many, many more. Other expected activities still on the drawing board. 1 month prior to this program, the PBO will be sponsoring a weekly game show for individual and team competition, like Battle of the Brainless, Trivia Question and Answer, Tagisan ng Konting Talino, and many, many more. In behalf of the chairman and the Board of Trustees of the Philippine Board of Orthopaedics, I would like to invite everyone to these festivities. Your presence will be much appreciated. I enjoin all fellows of the POA to take an active participation in this endeavor. All POA fellows, being diplomates of the PBO, are all bona fide members of the PBO as declared in its Constitution. We work as one. Mabuhay ang Philippine Board of Orthopaedics. Mabuhay ang Philippine Orthopaedic Association. Maraming salamat po.
Okay, thank you very much, dear sirs. The floor is now open for any comments, questions, or clarifications. I don't see anything so far in the chat box. So I don't know, either there's no one listening to us, or they're just wait because we're going to have the business meeting in about an hour or in about an hour. So they're probably reserving the questions there. Okay. So far, there are no questions from the audience, also from Burn. So thank you for informing us. With that, let's close the session. Thank you very much for listening. And Dr. Coruña, Gani, Dr. Pagaw, and Dr. Lopez, thank you for your talks. And we will see you later at the PBO business meeting. Thank you very much.
Thank you. Thank you.